Having spent 2 incubation cycles of 21 days each, making a total of 42 days, yesterday, the 10th of January 2023, since the discharge of the last confirmed case on the 30th November 2022, having registered no new Ebola case, despite sustained intense surveillance, both at the epicenter districts and nationally. I now confirm that all transmission chains have been fully interrupted and take this opportunity to declare that the outbreak is over and Uganda is now free of active Ebola transmission. 11th January 2023 marks 113 days since the start of the Ebola outbreak in Uganda, which was declared on the morning of the 20th September 2022. The outbreak started in Madudu sub-county, Mubende district, and at the time of confirmation, several people had been infected and others with symptoms consistent with Ebola had died. The outbreak was identified after an adult male who later died was managed at Mubende Regional Referral Hospital and confirmed to have been infected with Sudan Ebola virus disease. Prior to this outbreak, Uganda had registered 7 previous outbreaks, as outlined below. In 2018, Ebola Zaire cases were imported from the DRC into Kasese district, with 4 cases and 4 deaths registered. Case fertility 100%. In 2012, 2 Sudan Ebola outbreaks occurred. In Chivale district, the outbreak happened in July with 11 cases and 4 deaths. Case fertility rate 36%, while the Luero district outbreak happened in November with 6 cases and 3 deaths. Case fertility rate 50%. In 2011, Sudan Ebola outbreak occurred in Luero district. This was a 1 case and 1 death outbreak with no secondary transmission. Case fertility rate 100%. In 2007, an outbreak occurred in Bundibujo district, and that was named Bundibujo Ebola outbreak, where 131 cases and 42 deaths occurred. Case fertility rate 32%. In the year 2000, Uganda's first Ebola outbreak, Sudan Ebola outbreak, occurred in Gulu district, where 425 cases and 224 deaths were recorded. Case fertility rate 53%. The Gulu outbreak was and remains the largest outbreak ever registered in Uganda, which lasted for close to 6 months. This outbreak marks the 7th Ebola outbreak in the country and the 5th attributed to Sudan Ebola virus, which was last reported in 2012, more than a decade ago, in the then Chivale district, but present-day Kakumiro district. I'll give a brief outbreak description. In this outbreak, a total of 143 confirmed cases of Ebola, with 22 probable cases and 55 deaths have been reported, with a case fertility rate of 39%. 87 recoveries have been registered in this outbreak. Of the 143 confirmed cases, 85, that is 59%, were males, while 58, which is 41%, were females. By age, 26, which is 18%, were children, while 117, which is 82%, were adults. The outbreak started in Mubende district and was confirmed on the 19th of September 2022. It then spread to Kasanda, Chegegwa, Kagadi, Bunyangabo, Wakiso, Jinja, Masaka, and Kampala City. Outside the epicenter district, which is Mubende, secondary transmission took place in Kasanda, Wakiso, Kampala, Chegegwa, and Jinja. Despite imported cases in Masaka, Bunyangabo, and Kagadi, there were no secondary transmission. There was sustained transmission in both Kasanda and Mubende districts, making the two epicenter districts. The most affected district was Mubende, which is also the initial epicenter district of this outbreak, with 64 confirmed cases and 29 deaths, followed by Kasanda district with 49 confirmed cases and 21 deaths. The records in the other districts are as follows.
When we declared this epidemic, we assured the public and international community that Uganda has built a resilient system that is able to deal with any epidemic threat in the country. And we assured you that we had the capacity and we were going to handle. And in 10 weeks, in good record, Ebola that we had missed 2 weeks, and it penetrated into the community. I think this is the first time when we got this epidemic when it had been in the community for quite some time. But we're able to deal with this threat and bring to a halt. We want to thank you so much.